Hi, everybody. Hi, I'm Tamika Jones. It is an E, but it's pronounced Tamika. I also go by Mika. No problem. You will not be the first person who did Tamika in the whole wide world, and you won't be the last. So glad to be here today. So glad to be invited again by Akessa to be part of this 440. So glad to see all of you on the call. I'm with the Indiana Coalition Against Domestic Violence. I'm a program director there. I've been there for 7 years, over 7 years, and a lot of my work is primary prevention. We have been fortunate enough as a domestic violence coalition to receive rape prevention education money and to work in primary prevention for over a decade, sexual violence primary prevention. And it's really exciting to work and have that overlap. And so I really am grateful to be here. Promise a couple of things to get you out in time for your lunch break and also to hopefully be engaging. So I'm going to ask you guys to be ready to go into the chat and say a few things as we continue along. I'm just giving you fair warning at the beginning. I'm going to need you to be part of this with me. So we'll move right on into what we're talking about today. We're talking about primary prevention. Most of the work we do in the the work of sexual, domestic, interpersonal violence is responsive. It is immediate, it's crisis, it is important. And we don't necessarily have a lot of time and energy to invest in start the problem before it starts. And we actually do it because we're always inundated with the problem. It's hard to even imagine what it looks like to do that. So we're going to talk and explore that a little bit today. Really talking about stopping addressing violence, the conditions that enable violence, so it never happened in the first place. So, one of the ways we at ICADV really dive deep into issues is through a fun, interactive toolkit we call Prevention Toy Box. It's not actually toys, but it is activities that are engaging and fun way to think about really hard issues. So I'm doing a very quick abbreviated version of an activity we do with groups in person to help you understand some of what we're talking about. So this is where you start chatting. So we're imagining you guys live in Speedy Town. All but 35 of us are part of Speedy Town. Speedy Town is a place that has absolutely no rules to the road. None. And as a result, there are a lot of accidents, a lot of injuries, a lot of harm, a lot of deaths. Doesn't matter who's behind the wheel, how slow, how fast you go. And it's just a really serious problem. You guys are the community forum who are impacting city planners to decide, how do we address this problem in our great town of Speedy Town? How do we stop people in hospital all day, every day for just being hit by cars, ran over? What do we need to do to change the conditions in our city, in our town? I want you to just think for a few minutes. And what advice would you give to city planners to really address the problems in Speedy Town? Why are people such bad drivers? Why do people get harmed? So the first question is, why do we think members of Speedy Town are such bad drivers? What are enabling those bad driving ways? Lack of education, lack of guidance, safe driving, this lack of safe driving techniques. We're just gonna keep thinking, keep typing. We usually give about 25 minutes in the real activity. So please feel free to write more than one comment as you keep thinking, like, what is needed in this town that has absolutely no guidance, no rules, nothing about the city supports driving. No consequences or accountability. They need to post speed limit signs and stop signs. That's a really good point because you can educate about safe driving, but you don't have the signs. It's kind of hard to follow rules. Awareness. Okay. Give it just a few more minutes. Anything coming back? Bad roads, no signage, lack of responsibility, education to put yourself in others' position, no one enforcing. Okay. See a little break. Feel free to continue to write and chat. Some of the things we've gotten in the past, and you can, thumbs up it if you agree. And I see that you guys have put a lot of it in there, but changes to the law, create speed limits, qualifications to be behind the wheel. As you saw in the previous image, it was a cat driving We can't have animals driving. We gotta have age requirements, enforcement of the laws that exist, consequences of those laws, like revoking driving privileges for those who commit violations. We're starting from scratch here, right? Others, it says changes to the structure, and I saw that here too. Adding signs, traffic lights, making lanes, putting in speed bumps. Like even if you have no desire to follow the rules, those speed bumps will stop you some way. Increasing public transportation, walking systems, bike lanes, restrictions on cars, odometers, or whatever speed, so they can't go so fast. Some people have even suggested, like, why do we even have cars? Why can't they just walk? It's a town, or ride their bike or roll. Some people have said incentivize, creating like financial assistance, which we do, incentives for safe driving, like discounts or for your insurance discounts or lanes or fines for violations, investment into the infrastructure. We've seen some of those things too. We've heard norms, how we celebrate the cool people because they're late to the party, like it's okay not to be, changing the name to Slow Town, things like that. And then we also have seen like understanding what the big hurry is. Like, why does everyone have to be somewhere so fast? So maybe we have too rigid expectations in our town, like maybe the school schedule and the work schedule's in conflict, like those kind of things where people wouldn't be in a hurry if maybe the town's norms in that sense was different. Do you guys think some of those sound like a good idea? I'm just gonna, yeah, I see if one thumbs up. Thank you, I guess. All right. So, like, we do too. Like, we thought those are really great ideas. You're talking to your city planners and you're creating a really phenomenal infrastructure to kind of create changes that stops it. Well, here's some other ideas. And you tell me if those are good or bad ideas. How about we just tell walkers it's dangerous out there? Every 15 minutes, a pedestrian gets creamed. We're making people aware of the problem. You think that creates safer conditions? How about telling people, just stay home? It's dangerous out there. Don't get on the roads. Dressing pedestrians in armor and pillows. There's a lot of them in the hospital, a lot of them getting hit hard. Let's just protect the pedestrians by arming them with like physical protection. Safe classes for pedestrians. Hey, you know what? This is how you dodge a car. This is the best way to move around them. Build more hospitals. People are getting hurt. We gotta have more hospitals to take care of these people who are hurt. Yeah, I see a lot of thumbs downs, but I also see this is a lot of ways that we parallel to how we address violence. The assumption is with these ideas is that those cars are gonna drive recklessly no matter what we do, and you are gonna be harmed, so let's keep you safe. And that's our approach to violence. And primary prevention's approach is it's possible to build the place. It's possible to keep people safe from perpetration of harm. It's possible to make safety accessible and easy, and we don't have to dodge and armor ourselves to protect ourselves on a regular basis. So, from the previous ideas, we take away that dangerous driving is not inevitable and that there's more ethical and effective prevention strategies instead of an individual responsible for their own safety, the ones that are most vulnerable. Yes, I already did this slide. So a lot of our strategies and a lot of what we do and a lot of what we think we can do and only do lies in more traditional strategies is attitude and behavioral changes, telling people this is bad and you need the skills and knowledge it's our go-to. You need the skills and knowledge to do better. But just like in Speedy Town, if we don't have world signs, that's our structural change. We don't have the infrastructure. Telling people to do better and make the right choices doesn't have anywhere to land. We also know behavior is complicated and it's influenced more than just by awareness and education. Have you all heard the terms like when in Rome and the company you keep? That means that what surrounds us kind of shapes us and we're opted to do the thing that is around us, even if we know better. One of the things that always gets me, I hate speeding, I hate car accidents. I'm kind of like a really safe person in the car, but I'll speed when everyone else is for sure. Like I don't want to be that person that people have to keep going around. Just do what makes sense because this everybody's going 80, I'm going 80. I mean, and so like we do what is around us, whether we know it's right or not. The best of us do. And those with less like impulse control, autonomy, etc., will do what's around them as well. This quote says it's unreasonable to expect that people will change their behavior easily when there's many forces of social, cultural, and physical environment that conspires against the change. Thank you. And interventions, long-term success depends on us supporting those contexts that contract contradicts our mission. So primary prevention not only like thinks about what it looks like for the violence to never exist. It gives us somewhere to be after, or somewhere to aspire to be after someone has experienced harm, been the harm doer. And so it's thinking about what we need to do to make things the easy choice, be the safe and accessible to safety choices. So just a few examples to put this all in perspective. Like I just said, I think cars are the scariest weapons on earth to me. And I drive every day, but I also have all these rules in my head, get on the road and I do what makes sense because everyone else is doing it. Another example, everyone knows they're supposed to get health screenings all the time, like every 6 months, dentist, every year, eye doctor. But what if your insurance premiums are too high? What if you don't have health insurance? What if you don't have access to get to a place on a regular basis that provides you that? What if you work two jobs? Or if you just work business hours and you don't have leave time and all the offices and doctor's offices closed? Like, it's also that is not the easy choice for so many people to get their health screenings for so many reasons. We all know we're supposed to have a really diverse meal. You're supposed to have all the colors every day. You're supposed to have all the types of food that brings in all the vitamins, and that's how we're supposed to eat every day. And that requires time to cook, to grocery shop, to be at the stores that have all the things, to have the money to pay for all the things. And most of our schedules, it's difficult to find schedules to do that for a lot of people, I would say. Or you just don't feel like it, like me. But yeah, so it's not the easy choice to have fresh everything. It's not the easy choice to cook 3 meals at home with all the colors. It's the choice to make, and it's not the easy one. And we also talk about things like moving your body 20 minutes a day every day. Sometimes it's easy. You have sidewalks in your neighborhood. You have street lights to get out before work and after work when 'cause it's about to be that season when it gets dark all the time. I'm sorry. I got issues with fall and winter. But, so you don't have a gym membership, you gotta get outside, you have streetlights, you have sidewalks, you have ways to do that, and others don't have that access to those movements that make it the easy choice. So what primary prevention really focuses on is making the thing we wanna see more of, the thing we wanna see often, the thing we wanna highlight, and the thing we want people to be is the easy choice. And there's so many different ideas to do that, but it's not, one we spend a lot of time on. So we talked earlier about some of the ways that we address and we move into primary prevention. And we talk about prevention, awareness, and risk reduction. And so I just want to talk about some of the differences in those. Like awareness tells people about the problem. And I think it has its purpose. In my opinion, that purpose really lies into bringing in attention to people who can provide support to that program. Funders, politicians, lawmakers, people you want to collaborate with and join forces with. Like, hey, this is the extent of that problem. You really need to know it. And in some ways, it is telling people that cigarettes cause cancer and putting it on the label and putting commercials about it. And that doesn't necessarily change people's decisions on a wide scale. So awareness, the benefit of awareness. I think it's 1964 they said that people telling people that cigarettes are really bad and putting the Surgeon General's warning on it. People still smoke. That's not the thing that's changing that risk for the majority of people. Risk reduction, that's another thing that we often fall into doing in prevention, and um, that's not quite primary prevention, is like to seek to reduce the impact of a problem or the increase the effectiveness of the protections of an individual, but they don't really change the problem. So, example would be increase. Sorry, I didn't move my slide. Like we were saying, like what protections do we want to provide someone who reduce their risk. Like in Speedy Town, it was the armor. It might be a number of things. Who sees this in their work? We don't want to stop the problem. We want to reduce the individual's risk of being impacted by the problem. I don't know why that I can think of an example. And primary prevention really just changes the norms, the laws, the rules, the expectations, the conditions, the environments that makes the problem less likely. So we want to talk about the distinction of those three, because often if it's usually a little bit more accessible to risk reduct or provide awareness instead of changing those conditions, norms, laws, etc. I'm reading the chat for a second. We live in a world where people are told to get over it instead of being better people. So we also, when people we're working in prevention, we see a lot of intermingling community level prevention versus community based prevention. So we talked earlier about a community level prevention in Speedy Town would be bike lanes, advocating for bike lanes, putting a speed bump in neighborhoods where kids play, moving parks and recreation areas away from the streets, it back in like a play area. Like those are ways to invest in the community level. A community based program would be bringing all the people together and saying, and telling them we need bike lanes. Like you could be in the community, still doing individual work in the community instead of changing the environments and the condition. What we like to think about when we think about whether it's community level and community based is where is the impact at? Is it a change in the community or is the change relying on individuals to make a behavioral change? And this will make a little bit more sense in a minute. Here's some examples of community level versus community awareness. Community level prevention isn't determined on where you do it or who you do it with. It's about the impact. I just said that. All right. So I'm ahead of my slides. So why primary prevention? First, we know that the intervention and punishment that we've implemented has not stopped the problem. The intervention doesn't help everyone. It's more efficient to address the source of the problem, like in Speedy Town. What was the source of the problem? And ignoring the source leads to worsen impact, which means the more it becomes what surrounds us, shapes us. So ignoring the source of the harm creates more willingness to accept harm and do harm. Is kind of ignoring that portion of it really increases the access of violence, the ability, the use of violence. Prevention strategies work to improve factors across a broad range of issues, which I really like, and we'll talk a little bit more about that, and improves everyone's quality of life. Imagine Speedy Town again, and some of the strategies we implemented does so much more than stop people from being hammered by cars and sent to hospitals. Speedy Town interventions, creating sidewalks and road, it could probably increase business and jobs, right? Because other people outside of Speedy Town will be willing to be like, hey, I like Speedy Town. It's a cool place. I'm going to invest my business in there. Like there's so many other positive outcomes of investment in infrastructure at Speedy Town in creating policies and norms where responsible driving. So I think the insurance rates will go down. I mean, there's so many reasons that's just the hospitals are inundated with accident victims that can invest in people for preventative health care. Like there's so many reasons. So like what I'm saying, when we think about prevention, it really addresses and improves quality of life over so many issues. So then I'm thinking like, why are we spending so much time in our strategies that impact risk reduction or are solely based in information and talking to people about how to be better awareness campaigns? And we like to think that it's kind of like a low hanging fruit. There it's telling people there's a problem is relatively easy. It's hard realities, but it's a relatively easy thing. Telling people how to change their behavior is relatively easy. Outcomes of those are not saying the outcomes are very good, but it's really, really, really challenging and requires good strategies to think about investing in a strategy that really changes the conditions, being really strategic about what are we trying to solve and how do we really solve the thing. And we believe investing our limited energy into a thing that really impacts a bigger group of people, bigger groups, larger amount of the community impacts a broad group of people. I forgot the word I'm looking for. So I wanted to talk about the distinctions and why we really focus and why we really want to move into primary prevention. And so let's talk about what we really mean. So primary prevention. So we think and that prevention strategies is really thinking about personal and interpersonal and relationship level. And this is just an example of a social ecological model. There's many examples of such. Just one I just chose to use for this slide. It may not be the most relevant to your work, but we know that the impact is greater when we think of strategies and we do interventions and we think about creating change and impact at the broader the scale, the more people you reach. So we like to think that we're kind of greedy in my time. If I'm working 8 hours a day, I want to impact as many people as possible. And if I'm centering my strategies further and further out of that ecology model, um, and I think in social work, I don't know if we have social work people here, I think you call it you have a different name for it, but this is the public health terminology. And so, like, the more people I want to reach, the bigger change. So let's go back to Speedy Town. If I'm teaching an individual how to drive more safely and skilling them up and telling them scale without changing anything at the policy level, we don't see the impact as being very strong. The likelihood that that would be great impact is weak. It's less of a think that's wrong. Anyway, there's less of a likelihood that that person would be able to go into the road and the conditions and drive with those safe skills and actually create a safer environment for the pedestrians. But we reach out to those community factors, put speed bumps every 50 yards. That increases and impacts the whole community. So we want to focus on and we really focus in on how far out can we go for our reach. That makes, again, to make the thing you want to see the easy available choice and the thing you want to see less of way more challenging. Again, with the speed bump. If you want to speed, it's at your own risk. There will be consequences immediately. So and again, we talked about, we use the public health approach to create prevention strategies that hit out those outer levels of that ecology model. And these are the steps to the public health approach. We want to define the problem. And so this is super important because a lot of strategies requires us to be very, very realistic in what we're looking for and what we're trying to do. If we took Speedy Town, for example, this is why we like to play these activities and say the problem is too many people are in the hospital, we would create strategies to address the number of people in the hospital. If we would say the problem is, anything to that end besides traffic is out of control and we need to do a better job at protecting pedestrians from traffic incidents, then our solution will be based on protecting pedestrians from the traffic. So it's really, and we can word that a lot of different ways, but how you define the problem is going to be how you create the solution. So I want you to always to think really deeply about your work and what is the actual problem. Is the problem the people you're speaking to do different skills or learn something? They part of whatever you're doing, does it actually address the problem at hand? I'm sure that there's lots of different kind of people doing different work here. I should have asked that from the beginning. But this is what primary prevention focus on. We really focus time on spending what is the actual problem we're working on. If we're working on a community level, organizational level, societal level, and then we identify the risks and protective problem factors with that problem. And then we address a strategy that will prevent that risk and encourage that protective factor. And then we see if it works. That works, then, we move it on to different places. So this is the public health approach for primary prevention. This comes from the CDC, has an Office of Injury Prevention. If you're not really into like the deeper levels of prevention, they've been working in violence prevention and this gender-based violence, which whatever it's called now, with sexual violence, domestic violence, stalking, all those things. And this is the way that we've been told to define a problem and look for a solution in our work. It's very similar to what they do in healthcare. It was also, or any of the CDC's strategies, violence is in there. And so usually if I were to do any of that when it comes to violence, I'm gonna find that these social, economic, cultural, and environmental conditions are where we find a lot of the issues for where we can address the risk and protective factors to reduce harm, reduce the access to violence, reduce the perpetration of violence, reduce protections for people. I mean, increase protections for people. So we all of these are what we think of when we think about moving outside of that social ecological model. These are clear examples of some of the things we would do. So instead of saying if the risk factor is poverty, which we'll see in a lot of the work we do, risk factor is poverty, then what does employment rates look like? Where can we look at opportunities for increasing education, for better employment, for empowerment? Where we look things like that. So in the next couple slides, you'll see what I'm talking about. But when we think of prevention strategies, it's like we think about how there's such a clear overlap in all of these forms of violence that's on this board and other social issues. But these forms of violence usually it's a co-occurrence of them. If you experience child abuse, you probably experience youth violence. There's probably seen domestic violence, and your probability of bullying or being part of a bullying is stronger. Sexual violence is in there often with bullying and youth violence, elders, they're all kind of interwoven. And many of our work, we focus on one aspect of one part of our work. And when you think about primary prevention, it gives you access to really think about a broad scale of looking at all these different ways these violent things occur and how we can use our resources really widely. Because when we reduce these things, we reduce the other. When we address the risk factors here, we're addressing the risk factors to the other. And it's really an opportunity to really start to create the world we want to see. Here's an example. So this is the cut from the Office of Violence Prevention. I told you from the CDC. They have technical packages that tell us risk and protective factors and strategies that they recommend to address the harm. This is an example, or this is what they have for IPV. IPV stands for interpersonal violence. It's a form of domestic violence that really focuses in on those that you have an intimate personal relationship with, usually a partner or ex-partner, someone you had a relationship with or you had a child with. And sexual anyway, I didn't want to spend a whole day. So that's why we use a term that is more specific part of domestic violence as domestic violence is a household thing. So intimate personal violence. And so this is the strategies that they have here. And you see that we circled protective environments and strengthened family supports or strengthen economic support to families, improve school climate and safety. You see some of the approaches. This is just recommendations. There's other ways to create protective environments, but these are some recommendations on how to do those things. So they're telling us these are the strategies. Here's some examples of approaches to address the strategy. And these are the risk and protective factors, or these are the protective factors for IPV. Okay, where's my mouse? Okay. And then we look at the same technical package, the same type for SV, which is sexual violence. And this also has creating protective environments, improving school safety as an example. It also has empowerment of women and girls, which includes a strategy for economic supports. So when we create some strategies, we really like to center ours on creating protective environments because it hits so many of the other forms of violence, including sexual violence and sexual violence. When we look at how to do those things, we're really looking at addressing so many forms of harm. Am I right? Okay. Good solutions solve many problems. I love this slide because it really speaks to how we see primary prevention. We want to take the vulnerability off of the person who's already vulnerable and create really safe environments for everybody. So you see here that I have like a chart that just said what I said. If we look at strengthening economic supports, the sexual violence prevention package, the IPV, interpersonal violence package, the prevent suicide prevention package, and also the child abuse and neglect. They all want to strengthen economic supports. They all are strategies that increase protections. Creating protective environments are on all of those. Promoting social norms against violence, they're there. So essentially, primary prevention, people who work in primary prevention work as city planners for their communities, their city, their state, their school, their organization to look at the problem as you did with Speedy Town and what is really going to solve the problem where it makes the thing you don't want to see anymore. We as ICDV, we want to limit the amount of time that is wasted because we have limited resources and limited time, and we want to do it at the biggest, broadest scale. So, one of the things we do in Speedy Town at the end is ask if you could pick one thing that would be the absolute most impactful thing to do. You only have resources to do one thing for Speedy Town. What would it be? And because of the limited resources and time and urgency is usually the thing that would impact the most amount of people quickly. Most times it's things like speed bump. That's what it is because it's the thing that prevents you from doing the thing. It's the quickest thing and it helps every single person right away. So and I think that's what we have to think about with our work in the same way. Like resources keep getting less and less recently in this kind of work. And time is so important because every person matters. And we know victimization happens every day. So, where can we invest our time and energy addressing the thing that's the most impactful with the time, effort, energy, and resources we have? Here's a kind of example. This is from NSVRC, it's the National Sexual Violence Resource Center. They kind of outlined it all for us really well in a really simple way. So it talks about the individual relationship at the bottom, societal at the top, the community in the middle, kind of the same idea of a social ecology model, which I mentioned earlier. And there's many different ways, different types of models, but this one has those four different areas. And it talks about the risk factors, the protective factors, and this is just for sexual violence, the social determinants of health, and that would be the factors that's in that one slide I showed you before. These are also things, go back to it, things that people call social determinants of health, where you eat, play, live, love. Those are what they mean. Okay, I'll find you. Okay, they talk about what determinant of health is impacted and then put it all together in strategies. So we could talk through like the community level because I think most of us have access to some degree of community in our work. Even if we're an individual organization, we might consider that those people we serve are community. So the risk factors are poverty, lack of employment opportunities. So I'm trying to lack of support from the police and judicial system, general tolerance of sexual violence within the community, working community sanctions against sexual violence perpetrators. And then so the protective factors for this type of harm in schools, neighborhoods, communities is a community support and connectedness. When you are with and around people who care about you and you care about each other, your community cares about you, it's a protective factor. You're connecting, you're connected. Um, coordination of resources and services among communities, agencies, sexual violence resources could be I need healthcare, I need childcare, I need, that connection of resources and access to mental health and substance abuse services. And then those social determinants would be equitable access to education, economic and job opportunities, community engagement, social support and integration support systems, built environment such as building sidewalks, bike lanes, and roads and physical barriers, especially for people with disabilities. So they're putting it all together for us. So what would be an effective prevention efforts with all of those risk protections, social determinants? At the community level would be working in collaboration with communities around shared risk and protective factors can be an effective way to stretch limited funding, strengthen partnerships, and increase reach. So if you were in if you, and it's exactly what we did in Speedy Town. What is needed? How can we all do the thing that needs to be done together? We're connecting. We're looking at all the things that our community needs, and we're doing it together to increase those things and increase the others. So just an example. So in schools, a lot of people who do this kind of work with young people. And so how can we then stretch that strategy that whatever strategy we're doing, stretch it to say what protective factors needed here in your school and how do we work together to make it happen? We've had strategies for homeschool based programs to create a list of things that the school administrators need to do, like put a light in that hallway, because stuff happens in that hallway, or put more monitors there, or just a list of how do we create a protective environment as we educate people about the risk and protective factors while we're providing them resources. This is really cool. I really like it. Put it together for your community. I can give you the links to all of this if you'd like. But basically, like, this image is really a good representation of what we think of primary prevention, and so, like, we really don't wanna spend our time putting helmets on mice when the environment is just dangerous. It's a waste of resources, it's a waste of time, it's a waste of money. We can't give every mouse a helmet. We really just wanna move the traps, and we wanna work really hard to make sure those traps are eliminated. And so, I don't really like mice, but I love this image. Really like to you all in the chat to kinda tell me either, like, what are your thoughts on what I've said about primary prevention? Do you see it in your work? Would you like to see more of it? I don't know what kind of work everyone is doing, but I'm excited to understand a little bit more. Have you been exposed to these strategies before? And I can and if nothing else, I can tell you kind of really specifically some of the ways ICADV has implemented primary prevention strategies. And I can go into that waiting for the chat. First thing we always do, and so we're a state level organization. So we do a lot of stuff on public policy, that clear line. We know we want to advocate for, pay family leave, for example, because it gives all those protective factors. But there's some more smaller things we do. We, at a period of time, was able to fund programs to do primary prevention strategies, and we still have one program and really work with that a program in that community to see what they need. First thing they need to do is define the problem, and that requires community assessment. What does the community need? We believe in asking the communities what they need. This had a program in Southern Indiana that talked to a small rural community, and they needed some community connection. They were a very struggling community. They had a lot high poverty, and they also needed those stable basics. And together, with limited resources, that county was able to pull together resources. They had an abundance of substance use in that county, abundance of DV in that county for the size of it. And the county says, this is what we need. They took some land in a faith-based community, a community who was strongly faith-based, near a church. The church had the land, built a large community garden, got investment from every sector of the need. The electric company or whatever that was down there, the energy company provided the lighting and created the infrastructure for lighting. The local sports team, like a college that wasn't too far away, it came and did the physical labor to help put the things in. With donations from community partners, the mayor of the town was in. The flowers and stuff was donated from different parts of the thing. The courts, the drug courts invited people who are doing, like, their substance abuse the consequence of having a substance abuse charge in drug court. They were out there working with their hands. They had the opportunity to help invest, like planting and doing all of these things. All these things are protective factors for so many things, child abuse, elder abuse. And they were able to build this area for them to be engaged with each other, have a place to sit, play, talk, gauge, and also a place to get food and vegetables with each other. This was like a comprehensive strategy for a community that really took very little time and effort from a preventionist, but it supersedes that amount of money that they had. It supersedes that small grant, and it works in the community long term. And all the while when they're there, they have information and words and affirmations about just connecting and how it is preventing all kinds of forms of violence in their community and suicide. So that's just an example. We have a project in Grant County doing something building up a whole network of ways for that county to just connect and provide risk and protective factors. So the first step we always do is listen. The second step, we don't make the responsibilities of change to be on the backs of those who are most vulnerable. We reach out to the resources where the community is, where the community resources are, to create the change, to make the environmental structure, the environmental change, one in which people thrive and people are connected. And so those are just a few examples. Right now, we work with people with disabilities and a leadership team to address the needs of people with disability throughout the state. And that may include some economic empowerment strategies. It can include changing how information is shared so people with disability have access to the information they need. So we really just want to create a world where everyone can thrive. And that is what primary prevention is. And so in this hard work that we do, to me, the light of it all is primary prevention because we're able to imagine the world that we want to see and really invest our time and energy in creating it and know that the things that we are advocating for risks, advocating for as protections, protects us all, makes us all better, makes us all life easier for us all. So that is primary prevention in 1 hour. Uh, and I told you I'd get you to lunch on time. Are there any questions? And please reach out to me if this was a lot of information really fast and a little confusing. I'm happy to spend more time with you. Here's my email address. Okay. Well, if anything else, you'll
Yeah.
get the slides, and I don't have anything else.